Now let's dive deep into this big LGBTQ story for today. I'm Von Biggs, and let's queer up health. Will the Supreme Court limit or eliminate access to PrEP? Here's what they will consider. On Monday, the U.S. Supreme Court will hear Kennedy versus Braidwood Management, a case that could reshape preventative healthcare access for millions, including many of the LGBTQ community. Here's what is at stake. The Affordable Care Act's mandate says insurers cover preventative services like PrEP, HIV testing, and cancer screenings at no cost. The case began with a Texas group of Christian employers who object to covering PrEP on religious grounds, but has now grown into a broad challenge to the very foundation of the ACA's preventative care protections. At the center of the U.S. Preventive Services Task Force, whose expert recommendations determine what services insurers must cover, plaintiffs argue it's unconstitutional because its members aren't confirmed by the Senate. José Abrigo of Lambda Legal calls the case about whether science or politics will guide our nation's public health policy, allowing ideological or religious objections to override scientific consensus would set a dangerous precedent, end quote. The lawsuit is led by Jonathan Mitchell, the same legal strategist behind Texas's extreme abortion ban. LGBTQ advocates say his long game is to dismantle civil rights protections, including those that benefit queer Americans. According to Jeremiah Johnson of PrEP4All, quote, over 150 million people could suddenly have to pay for care they once got for free, end quote. Even small cost increases can lead to steep drops in access. The court's decision is expected by the end of June. You know, in Broward County, we have a lot of issues that we talk about, especially about access to care. But, you know, this case challenges the very foundation of the Affordable Care Act's protections, which have ensured that services like PrEP, HIV testing, and cancer screenings are available at no cost. If the court rules against these protections, it could lead to significant barriers to accessing essential health care, disproportionately affecting those who rely on these services the most. And that's what we see when we find people don't get access to medications. I mean, we see it today, even in HIV treatment. People, if they have struggles or access to barriers or something, they just stop taking the medication. Yeah. I mean, we see people that have been out of care for years and have not taken medication, and now they're deathly sick. And we've got to find better solutions to get people access to care.
Wow, but 150 million people. Like, can you just imagine that? Right. That you're used to being on PrEP, you're used to not paying for it, and now all of a sudden with how everything has increased in our lives, you also have to figure out how to pay for PrEP. So then do you just say F it and not take it, right? And then put other people's lives in danger? Like, Bond? Like, what can you do?
You know, it comes to a lot of things. Like, if you're talking about PrEP, you know, you have to talk more than just PrEP. You also have to talk about treatment. You also have to talk about the cure. They all have to work together. They're all equally important to one another. But really, to end the HIV epidemic, it is viral suppression. We're going to have to get to viral suppression. We've got countries that are very close to that number, and I think once we can get there, and I have to believe, you know, when the president had enacted EHE funding, that's actually been proven to be the most effective program out there to end the HIV epidemic, and that is because it's going after those people who are out of care. Yeah. It's re-engaging them back into care, and that's what we need to do.
Yeah, and this is so scary on so many levels. Like, you know, Miami is number one when it comes to HIV/AIDS, with Black women being number one. You know, this is not HIV and AIDS is not something that just affects gay people. You know, and they keep on saying we don't want to help anybody. We don't want to help you gays. You know, what happens to the heterosexual folks that are also living and trying to thrive with HIV right now?
When you look at the overall world numbers, and I like to look at it from that worldview, because
you're a nerd. That's why, and I love it.
I love data. But no, more than 50% of the people living with HIV in the world are women. Wow. More than 50% are women.
Wow.
So it's not, like you said, it's not just gay. It's, you know.
Well, this case is horrifying because it is more than, PrEP is a very big part of this, but this is about blocking requirements of the ACA to mandate preventative care. Because before the ACA, you know, back in the wilderness of that time, an insurer didn't have to pay for preventative care.
Right.
And this is trying to do away with that. And we've seen so many parts of the ACA get whittled away the last few years, especially by the court. I want to remind people that the ACA was passed by a Congress that had the largest majority of either party in the 21st century by the most popular president ever elected. And every time the Supreme Court whittles away, it is an attack on democracy itself, because it was the most popularly elected group of people to pass a bill this century. But like, you take away this, these things are going to be completely unaffordable. Mammograms could be affected. PrEP is definitely going to be affected.
Birth control.
All of it. And like this is what, I always warn, you're never the one that I bicker with this, but other people, when we talk about any time Gilead have the product, it's very expensive, and I get worried about it. This is the main case that scares me the most with it, because people aren't going to be able to afford to spend $50,000 a year for that once or twice a year injection. Yeah. And how are we going to make sure that people get checked for cancer ahead of time? If you don't catch it, it actually is going to, of course, the insurers are trying to save like $5 doing this. But long term, it's going to be so much more expensive for all.
Yes, and then that's why when people say things like, "Oh, hospitals are making so much money," or insurance money, or pharma's making so much money, right? Like, they really don't know what that entails, right?
Well, pharma is really making so much money.
Well, yeah, and they will continue to do so. But I mean, they want us sick, Alex. They want us to basically have diseases like this, have more cancers, have more things that they could treat on the tail end of it instead of preventative.
Well, in reality, the group that's pushing it, they don't want us sick. They just want us sick if we're poor.
Wow. Mic drop. That is the big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.